Dana. How are you today?
I'm great. How are you today?
Good. I'm very well, and I'm glad that we are here recording our sixth version of the Pat and Jana Show.
I know, and at high request even. We just had our big educators conference meeting, and to much joy, it brought to ask when this was going to be published for all the candidates taking the ADEX dental hygiene exam.
And for the exams last year, I do have to say it is so rewarding that so many students come up after and they say, "Oh, we watched the Pat and Jana Show. We watch it. Like I can't tell you how many times we've watched it or whatever." So, our hope is that these are helpful to the candidates, students, or people looking for portability, and we'd certainly have fun doing it. You'll be able to tell that as we go along.
Yes,
Yeah.
absolutely. Well, Pat, we'll get started. All right. We appreciate you guys being here. Right. The joy that this brings Pat and I is, I hope, obvious by the time you finish. But really, we do this for you. Pat mentioned this was our sixth rendition of doing these videos for you guys, but it is meant to help you prepare for the exam. Maybe your school hosted a live webinar. Maybe they're watching this recording, right? It is all meant to serve you and help you prepare for the exam. We
And
are
I
going
can't
to,
stop.
oh,
I can't stop. We start without saying, and I have to say it all of the time. This does not replace reading the manual.
no, this does not. It
This
is
is
a really good, more entertaining, right? All of those things about this, but the manual still has some little nuggets of information. Matter of fact, Pat, you've reminded me, I want to ask you a question when we get there that the manual does have. I'll make sure we cover that today. But to begin
yes.
with, right, one of those things is ADEX portability. Every state that you see here that is purple on the map, as soon as you are successful on this ADEX examination, you can take that portability and go to these states and practice and apply for licensure. I do want to note each state has their own rules and requirements that you also have to take besides this clinical examination, but this does meet the clinical requirement for your portability and licensure. Most states have a jurisprudence, and they also require your national board exams. But I mean, Pat, it's a pretty impressive map to be able to, move across the country if you so desire.
Absolutely. We were talking before we started that this is now our fifth exam, our fifth non-patient exam, fifth version. And this map didn't have any purple when we first started. And that was just 5 years ago. And the difference even between last year and this year, it's remarkable. And they're just wonderful resources for us, for you, for organized dentistry. And look at that. You have to be able to call it a national exam with
Yeah.
just those very few exceptions, two exceptions.
Yeah.
It's looking great, and it's come so far in such a short time.
Well, and Pat, since we've started doing these, right, even the profession of dental hygiene and the mobility that it offers today compared to even, 5 years ago has become a world-changing offer, right, for some of these dental hygiene candidates just completing this exam, because we are hearing stories of students being able to travel and take that dental hygiene licensure and move about for job opportunities or different types of things that may be going on from state to state.
Yeah, definitely. It's people are taking advantage of it.
Yeah.
And we've always talked portability and the importance of portability, but especially now, I think preeminent in getting a license and being able to have that freedom and go where you want or where you need to go.
Yeah.
And this just does allow it. And gone are the days of my generation anyway, that you've taken 4, maybe 5, sometimes 6 different exams because you needed to move. And so this could be a one and done,
Yeah.
this exam, yeah, and it does it. And so that map is exciting. It's taken a lot of work, but all very worthwhile. And and dental hygienist, the profession of dental hygiene is certainly benefiting from all of that work.
Yes, agreed. And today, we've talked about the portability of ADEX. Now we're going to dive into those components of the ADEX examination. The ADEX dental hygiene licensure exam is 2 parts. It is, Pat, we've tossed around written, computerized, all the same, right? But the CSCE OSCE that is administered at a Prometric testing center, taken on a device. It is not on a piece of paper. Again, we lovingly call it written, but we definitely mean computer-based examination. And then you have your clinical examination, which is going to include detection, pocket depth removal, and calculus removal. So, or pocket depth readings, sorry, Pat, pocket depth readings, calculus removal, and calculus detection. One last thing I'm going to cover, Pat, is the fees of what this exam costs. Exam is $11.50. That includes both parts. So all in for $11.50. You also, for the $11.50, have a complimentary retake built in. That complimentary retake, where I will send an exam team if you need it, right? You all are spending time here with Pat and I to hopefully not need that retake, that we've prepared you well. But outside of that, if you need it, it's there. The 2 things that are important to note is that for the complimentary retake, you do have to pay for the typodont that you're testing on. We provide it for the first exam, but that if you need a retake, you're paying $150 for the typodont. And then in any scenario, some schools have a facility fee. So it's good to know if you're paying that facility fee, we collect it on behalf of that facility, and then we send it on to them. So you may see it when you check out. If you've got questions, if your site has a facility, you can find that on our website at adextesting.org. It will be listed or in the facility information page. Pat, I know you highlight that facility information page quite often.
Yeah, I do. It's a wonderful resource, and I want to recommend that to everybody, no matter what site you're going to test, but especially if you're not a student at that site. Go to that facility information sheet. You will find out fees and all of that, but you're also going to find out so much more about what the school is going to provide, where you're going to park. I mean, there's just all kinds of information. Your closest airports, there's usually hotel recommendations. So if you're going to be a guest at a site, absolutely use that facility sheet. But even if you are a student, take a look and see what it's saying there. You might even be surprised.
Yeah.
So do look at those, and they are online, and make sure you do that. And sometimes doing that before, can help you determine where you want to go.
Yep.
By information that's on that. If you're torn between registering for 2 sites, read those both information sheets, and from that information, decide what's going to be the best site for you to test at. Just so that there's no confusion amongst the group, Shana, what about the written, the OSCE exam and the free retake? Is that included in the free retake offer?
Pat, I appreciate you asking. The complimentary retake is actually just for your clinical component. That computerized OSCE that you're sitting for at a Prometric testing center still has a charge of $275 for a retake. Again, we believe you're not going to need it, but if you do, that clinical computer-based examination is $275 for the retake. Thanks for asking, Pat.
Yeah, good. I just didn't want there to be any confusion on that.
So speaking of OSCE, Pat, I want you to take us down the pathway of what this is, what we can expect from our visit to Prometric when we sit down and prepare to take the OSCE examination.
Okay, first of all, let's start. This is the content. It is, when we call it a simulated clinical. All of these slides are clinically based. It's not meant, excuse me, to be a national board. It's not meant to test a lot of theory. You are going to look at some type of a visual clinical slide or case study, and you're going to respond to it. So how do you prepare for this? You prepare for it by going to clinic, or if you're taking this exam as a graduate and somebody who's already practicing, you're preparing for it by seeing patients every day. So this is the content. It is based on 100 points. 100, what they call them scoring decisions. That doesn't mean necessarily there's 100 questions. It's just that there are 100 points. Some have multiple points. But if you look, and for those of us that can be challenged with mental math, when it's 100 points, this is real easy. That medical dental assessments, if it's 12%, then there's going to be 12 points that are going to be associated with that assessment. But if you look at oral exam, inter and extra oral exam and charting, that's a big chunk of this exam. It's 27%. And so this is something that we always felt is best tested in this manner. It's standardized. Everybody is seeing the same thing and evaluating the same thing. So that's the content. And how do we ask it? We ask it through a series of questions. Some are multiple choice. Here's some examples of what we called extended-based questions. Image-based multiple choice, you would see those pictures up on the left, and then you would just have selections. You would select the best response. Over to the right, extended match. There may be a situation, and when you look down at the bottom, I think that's the easiest to see all of the possibilities for matching. It isn't necessarily like the old days, you just draw one line, one column, one item on the left could match with 2 or 3 on the right. It's testing at I'll say a higher level than just a regular multiple choice question, and it's more interesting. People like these drag and drops, which is down in the bottom. There would be a slide, and then there's a number of statements, and you would look at each statement and drag that statement into the box that says, yes, that condition is present on this radiograph, or no, it is not present. So you can see how there's a number of responses here, and that's why the points are different. This isn't just a 1-point question, it's a multiple point question. And then on the right, the hotspot, I think this is maybe the favorite of a lot of people. There's 2 views here. The one that looks just like the radiograph is what the candidate would see at Prometric. They'd see that on their screen. And the one up above, which to me is purple, and there's a little green octagon. What you would do is you would point to, on that hotspot with your cursor, you would point to, if this was asking about caries, where's the area with caries? And as long as that your cursor is within, like say, the boundaries of that octagon, then that would be correct. It might ask for caries. You would identify caries. You may drag that to a vertical or a horizontal bone loss. So that's some examples of the questions. It is I call it, it's an interactive exam. It isn't just sitting there responding to multiple choice questions. Sometimes these are included in a case study. Sometimes they're standalones. But that's what the CSCE is. You have 2 hours to take this examination. You can go back and forth. You can stop. You can leave a question blank and then go back. And Prometric is great at explaining what the rules are and how to go about doing it. You register for this yourself, and you take it when you're ready to take it. Some people feel you need to take it before you take the clinical. Not so. Whenever you're ready, you schedule. Once you've registered for the ADEX exam, you've paid your fee, you're ready to go, that's your ticket to contact Prometric on your own and schedule your own exam at your own location at your own time.
And
So,
Pat, can I add real quick too? We've built in the feature where they will just from their profiles immediately go to Prometric. They will see schedule my OSCE. They don't have to leave. They don't have to remember any eligibility codes. It will show up right in their profile. They'll click a green button and it will take them straight to scheduling their appointments.
And how easy is that?
Yep.
One thing to remember is that a lot of professions use Prometric. Nurses do this, they give a lot of exams, and their schedule, their calendar books up. So decide when you want to take it, when you're ready. But I do recommend, especially in the springtime when so many professionals are scheduling appointments for lots of exams, to not get shut out. Book yourself an appointment as far ahead. You can always cancel it if you feel that you're not ready, as long as you follow the cancellation requirements. But don't find yourself ready to take it and go in and they don't have an appointment for 2 months or 6 weeks or something like that. So as I say, springtimes are the busy time, but this CSCE is meant, it's a clinical examination, it's entry level. the best way to prepare for it is by doing what you do every day, whether it's in school or whether it's in practice.
And Pat, what's the passing score for the OSCE?
The passing score for the OSCE is 75. You will receive your results immediately as soon as you hit submit, or whatever the word is that you send in, and, excuse me, and says that you're done. You will get your score. So there's no waiting around, by the time you leave.
Perfect.
You do have to bring ID, and the ID that you bring, I just want to highlight, is different than the ID that you can use for the clinical exam. For the clinical exam, you could say use a school ID that had a picture, but for Prometric, read their requirements carefully. It must be a government ID, and don't let it be expired. They won't take an expired license or an expired passport.
And we do detail that in the manuals as well. So make sure we're going to talk about that here in just a little while, but do know that that information is detailed for you, is the difference that you need for Prometric versus the clinical exam when you're checking in with Pat at an exam site. So speaking of checking in with Pat at an exam site, you want to take us now to that clinical examination?
Yes. Okay. So welcome to the review of the 2024 examination. The SimPro DH is that's what you're going to be receiving when you check in with us. We're going to give you an arch, and the examination is given on 2 arches. The calculus detection is done on the maxilla, and the calculus removal and probing is done on the mandible. When you're treating these are patients. This is your patient. Looks a little bit different than your patients in clinic, but this is your patient, and they should be treated exactly as you would treat a patient in clinic or in your practice. You're going to follow the same protocol for patient positioning and for infection control. You are allowed to use ultrasonic scaling devices. It says here if school or site allows. That was kind of a COVID issue. If they didn't allow it for some reason, it would be on their site information sheet. But I think I remember last year you saying, Shana, at this point, there wasn't a school that didn't allow it. But if you don't have your own and you want to rent one, if the school does rent them, and some do, again, great information on the site information sheet. This examination is also 2 hours, 2 hours with a what we call a uniform start. Everybody starts at the same time, and everybody will be, you can finish at different times, but everybody will be starting. 2 hours is plenty of time to take this examination. And I always say, enjoy this day, because never again in your professional career will you have 2 hours to scale 1 quadrant. Polishing is not performed or evaluated on a type-it-on exam. Hard and soft tissue damage is evaluated. We're going to talk about that after. When we said the uniform start, we check everybody in and everybody begins at the same time. And when you finish, you can check out whether you take the 2 full hours or you finish early. So infection control is at the minimum for a patient exam: mask, gloves, eye protection, and gown. Those are a must. You have to have that. If the school has any additional infection control protocols, we always follow what the school policy is. You'll find out if there's anything additional when you attend the Q&A that week of the examination, or whenever it's scheduled, and when you get to the school, but know ahead of time. You're going to be receiving an assignment. You're going to be assigned to group A, B, C. Some schools, the exam is in 1 day, others are a number of days. So when you get your schedule, you check the day that it is and the group that it is. And in your manual, you will see these times. You have a half hour to set up, and then you have 2 hours to do the exam. And then you have another half hour to check out, enter your findings, and check out and leave the clinic. So this is the 5th iteration of this examination. We really have the timing down, and it's very efficient. The use of time is very efficient. So that's your schedule. You'll see it again. You'll also get it when you register. This is the one form that is needed for this examination. I think when we did a patient, we had 11 forms or 12 forms or whatever, and people used to be frantic about the paperwork. No need for that. This is it. This is the one form that you'll be receiving when you check in that morning of the exam. It's called an ACF form. It's assignment candidate and candidate findings. This is your worksheet. You write on this. You can write on it in pencil, in pen. You can make little smiley faces on it. You can, but just make sure you can read it, because from this form, you're going to read it to us and we're going to enter all that information into the computer. So you'll see a spot there for candidate label. We'll be giving you that. Your labels, you're going to put a label on this form. You get your quadrant, see up in the upper right, this says LR. So this is the lower right is the assignment, and you'll see that there are versions. So this is a right, so the top of this form is purple. And what are versions? You don't have to worry about that. It doesn't make any difference. Your assignment, this is pre-populated, so your assignment is given to you. But for everybody that is doing the lower right and has one of these purple ACF forms, there are 5 versions. So there are 5 different examinations with 5 different assignments that are all mixed up. So no one from exam B, version B is a different exam than version A, but they're all equated and they're all equal. Calculus detection findings you're going to put here. That's, again, that's done on the maxilla. No instruments up there, just an Explorer. Don't go up there and try to scale it off. It's 3D printed. Don't dull your instruments, don't even try. So just an Explorer up there. And this is, this will stay, this will be on your type it on when you get to your operatory. There are 4 teeth that are assigned, and you do detection on 4 surfaces. If there is calculus, subgingival calculus, you write yes. If there is no subgingival calculus, you write no. If the calculus is light, you write yes. It could be light, it could be moderate, or it could be heavy. As if there's calculus there, indicate that. So you'll do 4 teeth, 4 readings worth 16 points. You can start with this or you can finish with this, whatever. We're not going to dictate how you proceed through this examination. This ACF form is in this order. You can follow that, but you don't have to. It's your exam. So that's the calculus.
Can I ask you about detection? I see we've got mesial, distal, facial, and lingual. The number one question I get about this section is, what if it's on the line angle?
Hey, if you detect calculus on a line angle, how you would score this is how you would chart it, probably in a normal charting. You distal line angles are always charted on the proximal surface. So if it's a distal lingual, you're going to on the distal say yes. Okay. You always, what you always, I'm going to say it again, you always chart a line angle issue on the distal surface, on the proximal surface, excuse me.
Perfect. And then let me ask you this, you mentioned light, moderate, or heavy calculus. Am I having to note that on this form, the type of calculus that was on these subgingival surfaces?
Yeah, good question, Shana. No, it's just the yes or no is yes, it's present, or no, it is not. But don't get hung up on it's just rough. A rough surface we're not considering to be calculus. Your Explorer has to catch, it has to bump over it. It may be different, it may be light, but you do have to catch. We're not counting rough surfaces as calculus.
Perfect, thanks, Pat.
Just make sure again, it's 16 points, no matter whenever you do it, if you do it at the beginning or if you do it at the end, just make sure that you're allowing enough time in your time management to get it done. So here on this sheet, it's telling you twice. Up top, it said that your assignment was the lower right. And just in case you didn't see it up there in that box, here it is big in front and center. Your assignment is the lower right. It's either going to be a lower right or it's going to be a lower left. If it's a lower left, up the top of that form that's purple will be yellow. But whatever it is, lower right, lower left, your assignment is the entire quadrant, every surface of every tooth in that quadrant. And then your last assignment, you have 3 assignments. Your third assignment then is your probing measurements. This is the only one that we do say it has to be done obviously after you have scaled, after you've completed your treatment. You're not going to be probing before you scale, because the graders are going to be probing after you scale. So you want to make sure that that it's the same. So after you finish scaling, you are assigned 2 teeth here, an anterior and a posterior, and you're going to record 6 readings on each of those surfaces. Again, don't worry if you make a mistake or if you have to cross it out, as long as you can read it. This is your worksheet. On the bottom in that little green box, there's a finish time. And I'm going to recommend to you, when the chief examiner or whoever starts the exam is going to say, you may, it's 8:05, you may begin. Your finish time will be 10:05. So they'll give you your finish time and write it in that box, because you may forget it. And it's just good to have it there as a reference of what your finish time will be. There's 2 boxes in beige here that examiners will at some point put their numbers in there. You don't have to worry about that. You're going to do your recordings of your calculus detection findings, and you're going to put your probe readings. You're going to read those out to us. We're going to put them electronically into the grading system. So that's the ACF form. It's your one form. You're going to be returning it to us. You're going to be getting it in a little plastic bag with your Typodont. It's going to be folded up in there. And when you finish, you're going to fold it back up and put it right back in there too.
And Pat, a couple of things for this year. I think that form will actually be in their operatory. It will be out with that mandibular arch ready for them when they come in,
Okay,
which is a new update for this year exam season. But I had one more question for you. You mentioned we have 2 hours here. Quick notice: if you haven't read the manual, you cannot bring anything that receives a signal. So no cell phones, no Apple Watches, no Garmin's that are receiving a signal. So how am I going to track? I've written it down at my 10:05 finish, but how am I able to track what time it actually is?
We always look at the clocks that are in the clinics, and we make note of those and try to get those calibrated. And we always request, if possible, if there are computer screens in each operatory, that they set it to time. So there'll be a computer screen there. If we don't have that opportunity, we do really try to have clocks that are visible. And while we're talking about time, although it's your responsibility to manage your own time, sometimes once you get started, you just, get into the zone and can lose track of time. We will notify you after 1 hour that you're halfway through the exam. And this isn't to make you nervous. This isn't to say, hurry up. It's just to say, you still have a whole hour. It's just to help you manage your time. We're also going to give you a notification when you have 15 minutes left. And at that 15 minutes, my recommendation is always, if you have not yet probed, put down your instrument, because you're probably at this point checking for the 3rd, 4th, or 5th time. But if you haven't probed at that 15-minute warning, it's worth 12 points. So make sure, I'd say put your instruments down and probe then, so that you can do it, so that you have enough time and you can record those findings. So sometimes I'd say, like, oh, we're going to give you warnings. And I don't like to use the word warnings, because that seems to be, oh no, I'm running out of time. That's not what they're meant. It's just to give you guidelines and give you just a heads up as to what time it is. So you are responsible, and it is our goal to do that. But we're not guaranteeing you those notifications. Who knows? Something could be an emergency going on in the clinic, and maybe we would miss. I've never been in an exam that I haven't been able to give the time, those notifications. But we just wanted to let you know that that's the goal, is to do that. Grading. Each Typodont is evaluated by 3 examiners, and they are examining under the same conditions under which you have been working. Are they going to wear loops? Yes. Are you going to wear loops? If you're used to wearing loops, then wear loops. It's not the day to do something different. Do what you normally do. It's not the day to try out a new instrument. But if you've heard these rumors that the examiners do different things. They are evaluating the same way you are. They're using tactile exploration. They're using their Explorer. That's how they're determining whether the calculus is remaining or not. They are not unscrewing the teeth and look at them. That is a vicious rumor. That's wrong. If you've seen it online someplace, don't believe it. It's the same conditions. They're using Explorers just like you are to determine if calculus is remaining. So how about grading? These are the points. This is an examination like the CSCE happened to be worth 100 points. So isn't the clinical exam worth 100 points? And this is how it's broken out. You've got 4 teeth assigned for calculus detection, 4 surfaces. Math is easy. It's worth 16 points. Calculus removal, you've got 1 quadrant. Inside that quadrant, you are required to scale all surfaces of all of the teeth. There are each version has is different in the 12 surfaces that are evaluated that are worth more points. Your assignment does have 12 teeth that are worth 12 and a half points. Every version is different, but that's when we say treat every tooth in that quadrant as if it is the one that is worth 12 and a half points, because each surface does have a point value attached to it.
Hey, Pat, can we clarify real quick? We have 12 surfaces worth 5.5 points apiece.
Isn't that what I said?
You said 12.5 points a surface, which would be a lot of surfaces.
Oh, no.
Or a lot of points. So 12 surfaces at 5.5 points apiece.
Phew. Absolutely. Yeah, thank you, Shana. That was a good pickup. So that's worth 66 points, but in the final case presentation, that is also about calculus removal. So those 6 points added to the 66, this examination is heavily weighted. 72 points is calculus removal. That's what this exam is about. So that's where your emphasis is. Periodontal probing, 2 teeth, an anterior posterior, 6 measurements. So that's worth 12 points. So again, I say make sure that you leave time, do it in whatever order you want, but leave a sufficient time to get that calculus detection done and to be able to complete your periodontal probing also. So that's your possible accrual of points is 100. For every error, if 2 examiners agree that there is an error, then you would lose the appropriate number of points.
Pat, I think for me, the biggest takeaway that I've heard you say, and we'll ask you to repeat it one more time, is we've been assigned in this example today, the lower right quadrant. We're going to remove all calculus from the lower right quadrant, and every surface is worth some sort of point value within that quadrant. So yes, just by removing it all from that single quadrant assigned, we'll earn 72 points.
If you remove all of the calculus from every surface, yes, you get 72. Those are your 72 points. And so the score that you receive is the accrual of those 100 points. How many have you accrued? Then after that, graders will also evaluate hard and soft tissue trauma. And if there are errors here, these are scored with penalty points. So if there's for both hard and soft tissue, there is minor tissue trauma and there is major tissue trauma. For soft tissue here, for every site of trauma, it would be -1 point. So there would be a penalty of 1 point, up to 3 sites. So you could have 3 areas of minor tissue. I'm doing here now, soft could be hard tissue too. 3 areas of minor tissue trauma, you would lose 3 points. But if you have 4 or more areas of minor tissue trauma, it jumps to a major infraction, and that is a 100-point deduction. So -1, -2, -3, your 4th penalty bumps up to a major, and it's 100. We feel like we do need to talk about this because it is a possibility, and it is part of the grading rubric in the examination. It is not something. It is the exception that we're seeing tissue trauma. It's not, I used to call it tissue drama because people thought it was, there was so much of it. These typodonts are wonderful facsimiles of a real patient. The tissue is realistic. It is expected that you can treat this typodont with good instrumentation skills, whether it be hand or power instruments, that you can adapt those instruments and not incur any tissue trauma. We want to just give you some examples of what a tissue trauma would look like. This would be an issue of minor tissue trauma, right around those two teeth. You see that? That would be -1 for each of those. Here's an example of a major tissue trauma. Both of them are considered major. We do want to say this, I think we mentioned that this is the 5th iteration of this examination and the materials have improved. And the tissue is really good quality. We think that it is a good simulation of tissue. And so some of this trauma, I think, is more difficult to get now than it did before. But these gives you an example of sometimes people be checking out, candidates would be checking out and saying, oh, I think I have tissue trauma or whatever. This is what we're looking at. I mean, this is the concern. So put it in perspective. Here's your patient. This is what you're going to get. This is what's going to be awaiting you, minus that mandible when you arrive at the examination. The difference is now, rather than bringing your own patient in the old days, we are giving you a qualified patient. We're giving you a patient that has everything that you need to demonstrate your ability at every exam.
Pat, I think you always say too that I think is reassuring to students, right, is that, or candidates even, that this is an entry-level exam, really reassuring them the type of examination they're taking through simulation.
Absolutely. And it's not an examination that is meant to trick anybody. This is an examination that is designed for to provide you with the ability to show your skills. And you've been well trained, or you've been out practicing, you have the skills, and it is entry level. We're not asking you to perform like if you've been out practicing for 20 years. We're not there to trick you. The calculus is not put in places that are there to trick you. We're not trying to put it so light that you are not going to be able to feel it. The examination is pretty straightforward. The calculus you should be able to feel with your tactile sense, and you ought to be able to remove it. I don't want to say easily, because that's a term that's so subjective, but it is entry level, and it is, for those of you that are still in school, it's more forgiving sometimes than clinic, where they don't allow you to make a mistake. You have to have it perfect. Here, you may lose a few points, but the passing grade is 75. But it is designed for entry level, and it is designed for you to be able to be successful, both in calculus removal, detection, and in probing. And people say that they think the tissue is realistic. I'm sorry.
No, finish that statement. The tissue is, were you saying realistic?
The feedback that we get, I always ask when I'm checking out people and entering their findings, what did you think? What did you think about the tissue? What did you think about the calculus and whatever? And most of them do feel that it is realistic, that yes, they had plenty of room to insert that probe. They could read it in, and that there was room for their instruments, even their Cavitron tips. So it doesn't have saliva, so it isn't as forgiving, without the saliva. But if you are, and I don't know if we've talked about this, if you are using a saliva ejector, which will be in there, make sure that you will have that wetness in the mouth. Make sure that you're keeping your area clear, the field clear, and that you are containing the water when you're doing it.
Yeah, we didn't cover that quite yet. The saliva ejector will go in at the base of the shroud, almost where the uvula is. And if you leave it sitting way up there, right, you're not going to get that water that's pooling. So you can pull it through and really maybe put a little bend in it to keep it down in the lower part of your shroud. But also, Pat, one thing I'm going to point out about the typodont here, that the head, it's translucent, and the shroud, they won't get hand fatigue. This thing is super stretchy. but that they can manipulate the patient to have turn their head right to left, and the exam team, you and yourself and those that are there running the exam, will give them instructions on how to move that head back and forth.
We'll be checking you in before, just to make sure that you understand your assignment and you have all your materials. And we always demonstrate to the whole group how to raise and lower and turn the head so that you'll be able to, again, simulate a patient.
And Pat, we've got the manuals online. They're there and ready. I think we even started today saying this video is all encompassing, there are still things that are in the manual that you need to know about this examination that we don't cover. Specifically about registration, we really haven't gone over that. We talk about what you can bring or what we would accept on site, but it is important to really know what we accept on site for registration and proof that you are who you are and that you've got your candidate number with you. All of those things are detailed here in the manuals for you, which are available online. And then the last thing, Pat has talked a lot today about the tissue and being able to manipulate your instruments and proper angulation. All of those things work to your benefit to avoid any kind of tissue trauma, which is what you're doing on patients today anyway. Well, we have 2 candidates who took this examination. They tested in the morning, they stayed and recreated their days with us. So while what we say is 100% believable, I think you can also hear from candidates who are just like you, sitting in the same position you are, right? Who can talk to their own personal experience, and they do. We allow them to kind of tell us what their day was like. We record it, and then we put that out into a production for you. So the same way, Pat, they have found this video on our YouTube channel. They can hop right over and watch that video. It's about 6 minutes long at the most. It is our #1 video on our website. This video here being our second in the lineup of what is most popular on our website as far as these video productions go. So
I think these are great. They're great support to the manual. I mean, people learn differently, and some can read it and they'll understand it. Others would rather hear it. Some have read it and then they hear it on a video. It's the more you do, the more confident you're going to be the day that you get there, and you're going to just understand what the requirements are, what is expected of you, what you need to bring. And hopefully, I don't know that we can take all the stress out of the exam for you, but that's our intention, is to give you as much information as we can so that you feel prepared. You're not anxious about it. You know what to expect. And I think by utilizing all of these resources, the manual, the videos, and I am going to say, and please attend the Q&A. That is something that's another great resource, especially if you're testing at a site that is not your school. You're a guest at a site. There's good information that's given during that Q&A session, and it's usually a few days before, so there's still time to do something about it. If you need to arrange or make arrangements, it's a good time to talk to the site coordinator. They're always on there, and they tell you about what they're going to supply and what you need to do. I think of course, this is the most important, is what we do on the Pat and Shana show. But I please do encourage you to participate in that Q&A session. I think you're going to find it really helpful. And one of the questions, and we didn't cover this before, and I want to say it is one of the questions that always comes up at the Q&A is the best way not to encounter tissue trauma to use dull instruments. And that's one that the first time I heard it, I was just really in disbelief. And it's like, absolutely not. You want to have the best, sharpest instruments that you can have. And you just want to angulate them and adapt them correctly. So having dull instruments is not the answer to anything. Shana, give them your expression, which I love. And I have to say, when I do my Q&As or orientations on a site, I use it all the time. But these are Shana's words about dull instruments.
Yes, so and this was born out of social media, of people trying to figure out how to pass this exam. worst place to try to figure out how to pass an exam is social media. But they would recommend bringing dull instruments to avoid tissue trauma. My statement that I make is that you can bring dull instruments to avoid tissue trauma, but you're also going to avoid calculus removal. So it is imperative to have sharp instruments in order to remove calculus, right? As Pat said, proper angulation and technique is the key to not having tissue trauma. Pat, I know you've got some things just some tips and tricks, but before you do, right, one of the things that I would like for you to quickly cover, you'd mentioned about being anxious, is what happens if I drop an instrument, right? That is another top question from the Q&As and live webinars that we host. If I drop something, what happens?
Okay. Again, remembering this is a simulated, this is a clinical examination. So we are following the patient infection control guidelines. So I'd say, first of all, I'd bring a second set of instruments. You may drop them. We have a process for that. But if you break your favorite instrument, that's a bad day when you're taking an exam. So bring a second set. But if you do drop an instrument, the protocol will be reviewed, but if you pick that instrument up off the floor and you started using it, that is a violation of the exam guidelines of the infection control guidelines, and that's a huge violation. That's a point deduction. But there is a process where you will come and tell your floor examiner what happened. You dropped an instrument. And I would say, if you came up to me, what would you do if this was a patient exam? How would you handle it? And you would go through the whole thing about you take off your gloves and what your whole process would be. As long as you do that, I would say, go ahead, you may use that instrument. And that is also applied to the saliva ejector. So often it's there, and with your elbow, you hit it, and the saliva ejector is going to end up on the floor. You can't just pick that back up and put it in the patient's mouth either. So there is a procedure for that. Make sure you do follow that. It's the difference between being able to continue your examination or to have an infection control violation. That's a pretty hefty penalty for doing that. Is that what you want me to cover?
Yeah, and at its simplest is just notify the team on site before you do anything. Don't pick it up, right? Acknowledge that it's happened. Meet with Pat or team that are there to help you. They'll guide you through the rest. So it's definitely not a reason to panic, but it is something that we don't want you to just pick up and keep working. We've got to acknowledge it first. Thanks, Pat. And like I said, I know you got some closing tips for those who are watching today.
I've kind of included a lot of them in, but what I'm going to suggest is whatever time you're told to be there, plan to be there earlier than that. I think one of the things that makes people most anxious is hurrying, rushing, or whatever. You know, Murphy's Law or whatever you want to call it, that's the day there's going to be an accident. That's the day there's going to be a traffic congestion or whatever. Leave yourself plenty of travel time. Leave yourself time to get to the site. And be able to find where you're going or just kind of decompress before. If you're screeching in there at, whatever the time is that you're told to be there, you're just screeching right in and have to sit down and get going right away. I think it's not a great way to start the day. Allow yourself time for something to happen. And, as I say, whether it be traffic or whatever, just don't cut it tight. I think people who come in and start off flustered because they were late and they were rushing, it's just not a great way to start your exam. It's an important day. It's your exam. I don't want to say it's your future. I don't want to put too much because I'm trying to say, don't be anxious about this, but I'll say, be smart about it. Give yourself extra time and plan to be early. Attend the Q&A. Don't try anything new. Don't try new instruments. Don't try, I don't know, any new process or whatever. Today is the day for the tried and true. It's for you to demonstrate what you've been doing, what your skills are. It's your day to show off. I always say, show us how good you are. That's what your testing day is all about. And so don't do anything new unless you have to. Maybe coming to a new site will be new for you, but everything in your treatment, do what you're used to doing, do what you know how to do. I think from doing this from a long time and talking to a lot of students, like exit interviews on the way out, like, oh, I wish I hadn't tried such and such. It's like, yeah, not the day to do it. Just do what you used to doing. But my two biggest ones are attend the Q&A if you possibly can and get there early. And know that everybody that's there from the CWC point of view, all of your examiners are there to assist you. We can't scale for you, we can't probe for you, we can't do your calculus detection, but we can help you with the process. We can answer your questions over and over and over. So don't be nervous that you don't know what to do and when to do it. That's why we're there. We're there to help you get through the process of the exam, and we love doing it. So please take advantage of our being there.
Absolutely. And we want to thank you very much for spending your time with Pat and I today on what we so lovingly call the Pat and Shayna Show. Pat, it was wonderful as always. I think we've covered great information for those who are preparing for the exam. You specifically, Pat, will look forward to seeing them at an exam soon. I mean, what are we? We're almost in February already. Exams begin this month.
Yeah, and so I get to see you on site. Shayna gets to see you on your live webinars at your schools. So we enjoy the interactions. It's fun. Give us your feedback. If we didn't cover something that you think it would be helpful, tell us. Tell us, because we've gotten some great additional information into these scripts or what we want to cover. So again, we do it to help you. So if there's more that we can do, let us know.
Pat, thank you so much. It was good seeing you today.
Thank you. Goodbye, everybody. Good luck.
Bye.